Before the Affordable Care Act, often referred to as Obamacare, the American healthcare system was in a state of crisis. Millions of Americans were uninsured, lacking access to even basic medical care. In 2010, the year the ACA was passed, nearly 47 million people in the United States had no health insurance. This meant that a significant portion of the population was just one illness or accident away from financial ruin. The system was broken, leaving countless individuals and families vulnerable. The lack of insurance had dire consequences. People without insurance often delayed or forewent necessary medical care, leading to preventable hospitalizations and worsening health outcomes. The cost of their untreated conditions often shifted to emergency rooms, the most expensive point of care, further straining the system. The human cost was immeasurable, with countless stories of individuals and families struggling with preventable illnesses, mounting medical debt, and the fear of financial devastation. The pre-ACA system was also riddled with inefficiencies and inequalities. Insurance companies held immense power, often denying coverage to individuals with pre-existing conditions or charging them exorbitant premiums. This practice left millions, even those with jobs, without access to affordable care. The system was complex, confusing, and often impossible to navigate for everyday Americans. The need for reform was evident, and the ACA emerged as a beacon of hope for a healthier and more equitable future. The Affordable Care Act, from its inception, aimed to address the most glaring problem, the vast number of uninsured Americans. Its primary goal was to expand health insurance coverage, providing access to quality, affordable care for millions who had been left behind. The ACA tackled this challenge through a multi-pronged approach, creating new avenues for individuals and families to obtain health insurance. One of the most significant changes introduced by the ACA was the creation of health insurance marketplaces. These online platforms, also known as exchanges, provide a centralized location for individuals and families to compare and purchase health insurance plans. The marketplaces offer a range of plans with varying levels of coverage, all of which must meet certain minimum requirements set by the ACA. This ensures that consumers have access to comprehensive coverage options that meet their healthcare needs. In addition to the marketplaces, the ACA expanded Medicaid eligibility, extending coverage to millions of low-income adults who were previously ineligible. This expansion, while adopted by only some states, significantly reduced the number of uninsured Americans, particularly in states that embraced the expansion. By providing states with federal funding to expand their Medicaid programs, the ACA aimed to create a safety net for the most vulnerable populations. Furthermore, the ACA initially included an individual mandate requiring most Americans to have health insurance or pay a penalty. While this provision was later repealed, its initial implementation contributed to the significant increase in insurance coverage rates. The mandate aimed to encourage younger, healthier individuals to join the insurance pool, helping to offset the costs of covering older, sicker individuals. This principle of shared risk is fundamental to making health insurance affordable and accessible to all. Before the Affordable Care Act, having a pre-existing condition was often a barrier to obtaining health insurance. Insurance companies could legally deny coverage or charge exorbitant premiums to individuals with health conditions such as asthma, diabetes, or cancer. This practice left millions vulnerable and financially insecure, forcing them to live with the constant fear of medical bankruptcy. The ACA revolutionized the healthcare landscape by introducing comprehensive protections for people with pre-existing conditions. Under the ACA, insurers are prohibited from denying coverage or charging higher premiums based on health status. This provision, one of the most popular aspects of the ACA, ensures that everyone, regardless of their medical history, has access to affordable health insurance. This protection has been life-changing for millions of Americans. Families no longer have to face the impossible choice between paying for essential medication or putting food on the table. Individuals with chronic conditions can access the care they need without fear of financial ruin. This fundamental shift in healthcare policy has provided peace of mind and financial security to countless Americans living with pre-existing conditions. The ACA's protections for pre-existing conditions are not just about fairness, they are about ensuring that everyone has the opportunity to live a healthy and productive life. When people have access to affordable health care, they are more likely to seek preventive care, manage chronic conditions, and stay healthy. This, in turn, benefits society as a whole, leading to a healthier and more productive workforce. The Affordable Care Act went beyond simply expanding access to healthcare. It also aimed to improve the quality of coverage available to Americans. Before the ACA, many insurance plans offered limited coverage, leaving consumers vulnerable to high medical bills and inadequate care. The ACA addressed this problem by establishing a set of essential health benefits that all insurance plans must cover. These essential health benefits encompass a wide range of services, including hospitalization, maternity and newborn care, mental health services, prescription drugs, and preventive care. By mandating coverage for these essential services, the ACA ensures that individuals and families have access to comprehensive, quality healthcare that meets their needs. Moreover, the ACA established minimum standards for health insurance plans, requiring them to cover a certain percentage of medical costs. This means that consumers are protected from catastrophic medical bills, as their insurance plans are required to cover a significant portion of their healthcare expenses. This provision has provided financial security to millions, preventing medical debt from pushing families into poverty. The ACA's focus on quality of coverage extends beyond the services covered to include the way healthcare is delivered. The ACA encourages innovative models of care, such as accountable care organizations, which incentivize providers to deliver high-quality care and coordinate care effectively. By promoting these innovative approaches, the ACA aims to improve health outcomes, enhance patient experience,